Hi everyone and welcome back to my channel. My name is Kahina. I imagine you probably already know that if you're clicking on my video, but if you don't, my name is Kahina. I have systemic lupus and I have had systemic lupus for 19 years, and today I'm going to do a video on lupus and pregnancy. Now, I'm currently pregnant, which is why I've decided to do this video. I am 34 weeks pregnant now. I do want to put a little disclaimer just to let you guys know what we're going to be talking about. There is going to be some discussion of loss of babies, of complications for babies, miscarriages, and the potential risks of those when you have a pregnancy with lupus. All of that is going to be covered in this video, so if you are not comfortable with that, if you think that is going to make you feel upset in any way, then please don't watch it. I don't want to be upsetting anyone or anything like that, so I just wanted to make sure everyone was aware what we're going to talk about before I get started.
Hey guys, editing Kahina from the future again. This is part 2 this time because again, video was going to be like 45 minutes long. So if you haven't seen part 1, probably go back and watch that first because it's going to cover what you need to do before you get pregnant, what medications you can't take and how long you need to stop them before you get pregnant, and the potential risk to you as the lupus mother of being pregnant. This part, which follows on from that part, is going to cover potential risk to the baby, as well as it will also cover delivering your baby, how you're going to deliver your baby, potential options for delivery, stuff like breastfeeding, everything for after the baby's born, and the potential risks to the baby are going to be covered in this portion. So again, the intro is not going to make very much sense because I didn't plan on filming it in 2 parts, but here's the intro.
If you are interested in other videos like this, I have done some previously on lupus in sunlight, what is lupus, that kind of thing. So I'll also link them up there as well so that you can peruse those at your own leisure. But yeah, if you're interested in this kind of content, feel free to subscribe, leave me a thumbs up, and also leave a comment below if you have anything that you are interested in learning about when it comes to lupus, and I can certainly make a video on that. I'm thinking of doing lupus and pleurisy next, so if you have any recommendations, feel free to let me know. But let's get started.
Girl, my arm is tired. This is editing Kahina from the future again for time number 4. Now, there's no easing into this video on account of the fact that it's been split from a different video. So yeah, where it starts isn't going to make very much sense, but that's because there's a part 1 and it will be linked.
The effects of lupus on the baby. I think this is the bit that is the most worrying, and this is the bit that you see the most about when you have lupus and you find out that you're pregnant and you go away and do your research. This is the bit that you see the most about, and it's the most worrying. I am going to cover it still anyway, but I want people to not necessarily worry because just because these things could happen doesn't mean they will. So the first one is intrauterine growth restriction. This means your baby is not growing properly and they are restricted in the room and they aren't growing to be the right size. You'll probably have more frequent scans to check for this. So I had scans at 6 weeks, 12 weeks, 16 weeks, 20 weeks, 30 weeks, and then I've also had 29 weeks, and then I've got 32 weeks, and I've got another one at, I think it's 36 weeks, to check the baby's growth. The baby is growing fine, but that can happen. This risk is increased with lupus, but it's only slightly increased. So this does not mean it's going to happen. This can lead to premature delivery. So it can lead to the baby being born earlier. Now, depending on how early is where your problems lie. If your baby is born early but at 35 weeks, probably be alright. If your baby's born early but at 23 weeks, unfortunately they're probably not going to survive. But your doctor will know that this is happening if this is happening. So you shouldn't be shocked on the day. They will do scans, they will check for this, and the risk is only slightly increased compared to the general population. Your next one is premature delivery. Now, premature delivery is common in women with lupus. Premature delivery is defined as delivery before 37 weeks, which is what is classed as full term. Obviously, pregnancy goes on for 40 weeks, but anywhere between 37 and 40 weeks, full term. Premature delivery happens in 40 to 50% of lupus babies. However, premature delivery could be 36 weeks, 35 weeks, 32 weeks, 28 weeks. Do you see what I mean? It's a very big gap that could be premature delivery. Depending on how premature the baby is born, will also depend on how dangerous that can be for the baby. So the risk of premature delivery can be increased by complications such as preeclampsia, organ involvement. This can be spontaneous, so you could just go into labour. It's more likely that if it's having a detrimental effect on your organs, your preeclampsia is there, it's not, you've tried treatments, it's not working, it's more likely they will induce you once the baby is big enough to survive on a neonatal ward. It's unlikely they're going to try and induce you earlier than that, unless it's really a dangerous situation for you. But once the baby's big enough to survive on a neonatal ward, they might think about inducing you. The most serious risk of premature delivery is breathing problems for the baby. So the baby might be born and not breathe properly. The baby may need to go on a ventilator. The baby may need to go in an incubator depending on how early the baby is born. That's the most serious risk. Now, if your baby is very early, there could be developmental delays, especially if you're looking at your baby being born at like 25 weeks, 24 weeks, there can be developmental delays there because the baby has not had enough time its brain's not fully formed yet when he or she is born. There can be feeding difficulties at any time with the baby being born early. Obviously, the earlier the baby's born, the more common that's going to be, and it can actually lead to neonatal death, which is your baby dying within the first 4 weeks. Now, there's no guarantee that's going to happen. Again, it really depends on how early your baby is. If your baby is extremely early, all of these risks are going to be increased. So the chances are they will most likely induce, but they will try and keep your baby inside of you for as long as possible, because that leads to better outcomes for the baby, because obviously they're only tiny when they're born. Even my baby at this point at 34 weeks probably only weighs about 4 pounds. So that's the best possible outcome, is for you to make it to full term. Other risks which are increased are loss of the baby or fetus, depending on when this happens. Now, this will include spontaneous abortion before 10 weeks, miscarriages between 10 and 19 weeks, and stillbirths from 20 weeks onwards. This risk is increased. There is an increased chance of the baby not surviving in lupus patients, but again, it's dependent on your personal health. Like, if you are in a situation where you have lots of complications, then there is a higher risk of this. I would say, instead of worrying about this, I mean, you're going to worry about it anyway, but your best option is to talk to your doctor about what that means for you personally, because lupus is a very broad spectrum. It can be severe, it can be much less severe, and that does not necessarily mean that these complications will be available for you. Like, you could have a completely normal pregnancy and no issues whatsoever. The last potential complication we're going to talk about is congenital heart block. Now, this can happen in women who have anti-RO positive and anti-LA positive antibodies. Also, if you have antiphospholipid syndrome as well, this could be happening. These antibodies can essentially cross the placenta and cause a blockage in your baby's heart. They only cross the placenta after around 16 weeks, and they will know if the heart blockage is going to happen by 29 weeks. So if you have these antibodies, you will more than likely have scans in the fetal echo department, which I did to check on the baby's heart every 4 weeks or so. They also do heart monitoring, which is undertaken by a midwife or doctor, where they will listen to the baby more often, they will scan the baby more often. A few babies will die due to this, but the majority are born, they don't die in utero, the majority are born. And the majority who are born do fare quite well. The chances are, though, they will have cardiac complications. So 30% will require a pacemaker during the first month of life, 30% will require a pacemaker during the first year, and the remainder will require a pacemaker by the age of 10 to 12. So the baby can still be born healthy, they will need a pacemaker though, just to keep their heart working correctly. This, I would say, was my biggest worry during the early part of my pregnancy. It's only been about 5 weeks since they told us, they can tell us with confidence that no, the baby's not going to have this, but this, I would say, was my biggest worry. But actually, it's only 1% of cases. I know that seems ridiculous for me to say that when I sat there and worried about it every day, but it is only 1% of cases, and actually the chances are your baby will still be born healthy and happy. They will just have to have more doctor's appointments in their early life and probably have to have a pacemaker fitted in that early life period as well. So delivery, let's talk about how we're going to deliver the baby. Now, my baby has obviously not been delivered yet. I'm still pregnant. So there's no reason why that must happen. There's no reason you must have a cesarean section because you have lupus. You will have planning and joint care. That is what allows you to have the normal delivery. There will be care, there will be doctors, you will see a lot. You will be at the hospital a lot. You will see a lot of doctors, you will see a lot of nurses, you will see a lot of midwives, but the reason they do that is so that they can prepare for your birth, which should be a normal birth. C-sections are normally reserved for emergency situations, so obviously every woman could potentially have an emergency C-section when they give birth. Women who've already had C-sections and do not want the trial of a vaginal delivery, so if you've already had a C-section, they will offer you the option to have a C-section again. And women who have severe hip disease, because obviously the baby is going to come out of your pelvis and that will put pressure on your hips. So if you have severe hip disease, you may be offered a C-section as well. The chances are that if you have active lupus or antiphospholipid syndrome or any of these, any potential additional complications, like heart involvement, kidney involvement, they will plan to do this by induction, but you can still have a normal delivery. You will just be induced. reason being, you'll already be at the hospital, you won't go into labour, shockingly, at home, and it just means everyone's there in advance, prepared. So that is how delivery will probably go for you. I'm being induced at 38 weeks because I have heart involvement with my lupus, and the idea is to keep my heart in good nick. We're going to try and do this as early as we can with the baby at full term. Obviously, that will not happen if you have premature delivery, which, fingers crossed, that does not happen. But bear in mind that premature delivery could still happen. So yeah, but there's no reason you shouldn't be able to have a normal delivery, and you won't necessarily have to have a C-section. Right, let's get this finished before the sun goes down and I lose my lighting. So, your third step is you've delivered your baby's happy, your baby's healthy, and now what? So, breastfeeding. There's no reason why you can't breastfeed. The only reason you wouldn't be able to would be based on medication, you taking medication that you cannot take whilst you're breastfeeding. Or you have a flare and you have to take medication, go back on medication that you were taking before, that you weren't able to take when you were pregnant. There's lots of benefits to breastfeeding which are recommended for the baby. There's benefits when it comes to infection, eczema, asthma, obesity, type 1 and 2 diabetes, childhood leukemia, and sudden infant death syndrome. For the mother, it reduces risk of type 2 diabetes, breast cancer, ovarian cancer, and postnatal depression. Now, yes, people will always talk about breast is best. There are lots of benefits to breastfeeding. If you can't, you should not feel guilty. You should not feel any type of way if for whatever reason you cannot breastfeed. The medications it's safe to take when you're breastfeeding. You can still take prednisolone. You can still take hydroxychloroquine. You can take your heparin injections and warfarin, which is aspirin. You can also take azathioprine as there is only a really small amount of it in your breast milk. But again, I'm going to put more information, I'm going to put that BUMPS website below. You can also get some information about breastfeeding from the Breastfeeding Network, so I'll link that down below. There is a risk of flares in your postpartum period, because obviously all that nice stuff that your baby was providing to you, keeping your lupus at bay, is now gone. Seek medical attention if you're in a flare, basically. If your body is flaring, speak to your midwife, speak to your doctor, speak to somebody and let them know, and they can appropriately manage your treatment. That's that on that. You also have an increased risk of blood clots, so that's the same for all women, but this is further increased if you have lupus, regardless of whichever antibodies you have. So they recommend you stay active, and you'll have to keep taking the heparin or the aspirin afterwards for at least, I think it's 6 weeks they recommend, just to help thin your blood and reduce any risk of clots. If you have any symptoms of a blood clot, basically go to the hospital immediately, which can include painful calves, breathlessness, your chest pain. Look, you need to seek medical attention immediately, basically, because often clots can be treated, but the earlier they're treated, the better. What you don't want is that clot to travel somewhere and end up in your chest somewhere, basically. That's not what you want. So after delivery, you should be able to, aside from any potential flares, you should be able to go on as you know, any other mother would. You may have a harder time based on the fact that you have lupus. You will be tired, you will be exhausted, but just if there's help there, take it, basically. If you think you need help, speak with your midwife, speak with your health visitor, speak with your doctor, anyone, and see if they can appropriately help you to make sure that you and your baby are doing the best that you possibly can be doing. Whew. We're nearly done. I am glowing. Anyway, so the big question that you might have on your mind is, will my baby have lupus? So, I'm going to attach my what is lupus video, which I've said that already, but I'm going to attach my what is lupus video because that will go through a little bit neonatal lupus. It will go through it a bit more in depth, and also it will be a bit more in depth on SLE as well. So, will your baby have lupus? Your baby could have neonatal lupus, first of all, which, again, in that video I'll discuss it a bit more in depth. Neonatal lupus happens in women who have antiphospholipid syndrome, also have positive anti-RO or anti-LA antibodies. Because they can transfer via the placenta to the baby may have neonatal lupus, which could give the baby a rash. They could have heart block, which we've already talked about, liver abnormalities and low platelets. The upside to neonatal lupus is that it does not last forever. Eventually those antibodies will leave your baby's system and your baby should be fine. You rarely see the rash at the time of birth because it often requires exposure to ultraviolet light, i.e. you taking your baby outside in the sun before it occurs. That often triggers it. And then your baby will get a rash similar to any skin-based form of lupus, circular red shaped areas, particularly on their face and around their eyes, on their scalp, similar to what is it called? So the baby will get a rash, red circular rash, similar to discoid lupus, especially on their face, scalp, eyes, again similar to discoid lupus, but it tends to go away after a while. The most common and important thing you need to do is keep your baby out of the sun. The sun, I'll link my lupus and sunlight video, the sun tends to make lupus a lot worse. So you're going to want to be keeping your baby out of the sun. It may leave mild discoloration, but it usually doesn't scar and usually doesn't cause any long-term problems. This does not appear to increase the baby's risk of having SLE in the future. Now, will your baby have SLE? Maybe is the answer. There are many genes involved in development of lupus, which obviously only half will be inherited from you, unless the baby's dad also has lupus. There can be environmental triggers. There's basically too many things that can have an effect to say with certainty. But it's not common for people to then have children who have SLE as well. It's not common. However, 1 in 20 people with lupus have a close relative who have lupus as well. So whether that be a mother, aunt, sister, brother, sometimes a father or uncle, but to be honest, it's not extremely common for you to have lupus and then your baby to have lupus. So, just moved in a little bit closer to say my goodbyes, but I want to thank you very much for watching this video. I'm going to link lots and lots of resources about lupus, pregnancy, breastfeeding, medication, all of that down below. Good places you can look at NHS Choices, you can look on Lupus UK, Baby Centre has a lot of information on pregnancy in general, and Tommy's. There's also a website dedicated specifically for parents with premature babies, so I can link that down below as well. Lupus UK do have a lot of information. They also have a booklet on lupus and pregnancy, which you may want to look at before you consider getting pregnant. But yes, that is it from me. I hope this video didn't make anyone feel too anxious about getting pregnant. Many women with lupus go on and have completely normal deliveries, completely normal pregnancies. Like so many women are completely fine and go on to have multiple children, not even just one. So I hope this didn't put anyone off. If you were thinking about having a baby or anything like that, the most important thing, I suppose, is to make sure you're speaking with your doctor, make sure you are talking to your doctor, make sure your doctor's aware of everything that's going on, and then between you can come up with the best course of action for you. You know, I hope I've provided some helpful information here about lupus in pregnancy. If you have any other questions about lupus or recommendations of videos that you would like to see about lupus, please feel free to let that information be down in the comments and let me know what you'd like to see, and I will continue making these videos because I actually quite enjoy it. And yeah, feel free to rate, comment, subscribe. That's going to be all from me for today. So thank you very much for watching, and I will see you in the next one. Bye!